So, a very good morning, everybody. Today we will be continuing with the pharynx. In the last lecture, we discussed about the different features of oropharynx, nasopharynx, and the laryngopharynx. Now, in this lecture, we will be discussing about the structures that form the wall of the pharynx, what is the nerve supply of the pharynx, and the blood supply of the pharynx. So, this is a specimen that is showing what do you see in this specimen? This is a sagittal section of head and neck region. So, in this we are what do we see here? This structure here is the tongue. Okay, this structure here is the palate. This is the soft palate here. This is your vertebra. This portion is your nose, the lateral wall of the nose. Okay, so this was the pharynx that was extending from the base of the skull till where? At the level of the C6 vertebra, where it was becoming continuous as the esophagus. Okay, so the part that was lying behind the nasal cavity, here, this was the nasopharynx. We saw different structures here. We saw the nasopharyngeal tonsils. We saw the opening of the eustachian tube. We saw the tubal tonsil. We saw the fossa of Rosenmuller here. Then we saw the pharyngeal isthmus, this part here. Then this was the oropharynx. This structure here is the tongue. This is the posterior part of tongue. This part is the oropharynx. Here, what is this? This leaf-like cartilage is your epiglottis. And this structure where you see the probe entering, this is the laryngeal inlet. So this part is the laryngopharynx. This part is the oropharynx. Okay. Now, let's talk about the structure of the pharyngeal wall. When we look at the wall of the pharynx, so this is a cut section which shows the pharyngeal wall. This is the inner structure. This is the outer part. Okay. So when we look at the pharynx, the wall of the pharynx consists of 4 layers from within outwards. अंदर से बाहर 4 layers. कौन सी? सबसे पहले we know we have the mucous membrane here. This one. After the mucous membrane, we have this fascia here, the green colored fascia, that is known as the pharyngobasilar fascia. After the pharyngobasilar fascia, we have the muscle layer that consists of the constrictor muscles and the longitudinal muscles. And then we have another fascia outside that is known as the buccopharyngeal fascia. Few points about each of these layers. First of all, this mucous membrane here. When we look at this mucous membrane of the pharynx becomes continuous with the mucous membrane covering the eustachian tube, the nasal cavity, the mouth, the larynx, and the esophagus. This is lined by non-keratinized stratified squamous epithelium, except in the region of the nose, where the nasopharynx, where it is lined by ciliated columnar epithelium. Okay. Then this fascia here is the pharyngobasilar fascia. This is present in the submucosa. It is a fibrous thickening that is present in the submucosa. We know that it lines the muscle coat here. When we look at it, it becomes more dense or more thick, where it becomes thick at the base of the skull. It becomes very thick. Okay. The pharyngobasilar fascia is thickest where? In the upper part, where it fills the gap between the upper border of the superior constrictor muscle and the base of the skull, and posteriorly it is thick where it forms this raphe that is known as the pharyngeal raphe. So here we see that this pharyngobasilar fascia is thick at 2 points. First is where base of the skull here, where it fills the gap between the superior constrictor muscle and the base of the skull, and another point posteriorly, this raphe that is formed by it is known as the pharyngeal raphe. Okay, after that, we have another layer that is the muscular layer here. So the muscle layer is formed by the outer constrictor muscles that are circular and the inner muscles that are longitudinal muscles. They will be discussed. Now, then we have another structure here that is known as the buccopharyngeal fascia. The buccopharyngeal fascia, when you look at the buccopharyngeal fascia, this buccopharyngeal fascia, it is not so distinct. It covers the outer surface of these constrictor muscles, and anteriorly it becomes continuous with the buccinator muscle. That is why we call it the buccopharyngeal fascia. Okay. When we look at it at the upper border of the superior constrictor, this buccopharyngeal fascia, it merges with the pharyngobasilar fascia. So this is a structure, this is an outline of the wall of the pharynx. From inside out, we have the mucous membrane, then we have the pharyngobasilar fascia, we have the constrictor muscles, the longitudinal muscles, and the buccopharyngeal fascia. Okay. Then we have another important structure that is known as the Waldear's ring. The Waldear's ring, अभी तक जो हम लोगों ने देखा, we saw that we had in the nasopharynx, we had a collection of lymphoid tissue. In the oropharynx, we had collection of lymphoid tissue. Okay, so there is an aggregation of lymphoid tissue which lies underneath the epithelium of this pharyngeal wall. This is known, these collections of lymphoid tissues are known as tonsils. We saw the different tonsils. We had the pharyngeal tonsils, we had the tubal tonsils, we had the palatine tonsils, and we had the lingual tonsils. When we look at these tonsils, these aggregation of lymphoid tissue that lies underneath the epithelium of the pharynx, we see that they are present in a circular manner around the opening of the pharynx. This is known as the Waldear's ring. Okay, this is the Waldear's ring. The Waldear's ring, so what is the importance of this Waldear's ring? The Waldear's ring prevents the invasion of microorganisms from entering the air and the food passages, and therefore it acts as a defense mechanism for the respiratory and the alimentary tract. So basically, they ask you what are the structures, what are the different tonsils, or what are the different aggregation of lymphoid tissue you see in the Waldear's ring. So Waldear's ring is consists of the pharyngeal tonsils, the tubal tonsils, the palatine tonsils, and the lingual tonsils, and they encircle the opening of the pharynx, and they prevent the microorganisms from entering into the air as well as the food passages. Okay, now talking about the muscles of the pharynx. So I told you that the muscles of the pharynx, we have the constrictor muscles and we have the longitudinal muscles. First, we'll discuss the constrictor muscles. The constrictor muscles जो हैं, ये क्या है? They are circularly arranged. They are circularly arranged like a flower pot, but they don't have a base. Okay, so गोलाई में present है pharynx की पूरी wall पे. We have these constrictor muscles. These constrictor muscles form the bulk of the pharynx. They arise, when we look at it, they arise from the openings of the nasal, the oral, and the laryngeal cavities. And then these fibers, the fibers of these muscles, they pass backward and they are inserted into the fibrous raphe or the pharyngeal raphe that is attached on the base occiput. Okay? And this pharyngeal raphe extends from the base of the skull till the esophagus. Okay, so अभी तक के लिए ये circularly arranged है. ये openings of the naso, oro, and the laryngopharynx, of the larynx की openings से आते हैं. They move backward in a fan-shaped manner, and then they are inserted into this fibrous raphe, known as the pharyngeal raphe, which we said that was inserted into the pharyngeal tubercle, if you remember the norma vasalis, and this fibrous raphe extends from the pharyngeal tubercle till the esophagus. Okay, now let's talk about the origin insertion of these muscles. So first of all, we look at this muscle. This muscle is the superior constrictor muscle. Okay, what is this? What are you looking here? This is the maxilla. This is the mandible that has been broken. This is the pterygoid plate here. This is the auditory tube. Okay, these are the cartilages of the larynx. So talking about the superior constrictor muscle first, this one. Okay, I have another diagram here. When we look at the superior constrictor muscle here, we see that it arises from the pterygoid hamulus, which is present on the pterygoid plates, the pterygomandibular raphe, which you would have studied in mandible. Okay, then here you can see the mandible has been broken, मतलब half करके दिखाया गया है. So obviously it will arise from the medial surface of the mandible and the upper part of the mylohyoid line, and it also rises from the side of the posterior part of tongue. It goes backwards, this superior constrictor muscle. It is inserted directly into the pharyngeal tubercle and this median fibrous bracket. Again, we'll see that the superior constrictor muscle, it is a quadrangular muscle which arises from the pterygoid humulus. It arises from the pterygomandibular raphe. It arises from the medial surface of the mandible at the upper part of the mylohyoid line and side of the tongue. It moves backwards. It is inserted into the pharyngeal tubercle and the median fibrous raphe. This muscle is supplied by the pharyngeal branch of vagus nerve. The pharyngeal branch of vagus nerve carries some of the fibers from the cranial root of accessory nerve, that is the 11th cranial. The function of this muscle is that it helps in deglutition. Okay. Then we talk about this muscle here. This muscle, obviously this is the posterior view. This muscle here is the middle pharyngeal constrictor or the middle constrictor of pharynx. When we look at the middle constrictor of pharynx, we see that it arises from this ligament here. This ligament is known as the stylohyoid ligament. So it arises from the lower part of the stylohyoid ligament. At the same time, it is also arising from the lesser cornua and the upper part of the greater cornua of the hyoid bone. This is the hyoid bone. Okay. So here you can see this is the middle constrictor. This is the stylohyoid ligament. It is arising from the stylohyoid ligament. It is also arising from the greater cornua and the part of the lesser cornua of the hyoid bone. This muscle here, this is the hyoid bone, posterior view of the hyoid bone. It is inserted into the median fibrous raphe. The nerve supply is the same, that it is supplied by the pharyngeal branch of vagus, which is carrying fibers from the cranial root of accessory. The function of this muscle is also that it helps in deglutition. Then coming to the third muscle, that is this one. This is the inferior constrictor of pharynx. Now, the inferior constrictor of pharynx consists of two parts. We have the thyropharyngeus muscle and we have the cricopharyngeus muscle. There is a clinical importance of these two muscles, which I'll tell you. First, let's talk about the origin insertion of these muscles. When we look at the thyropharyngeus muscle, this one, it is arising from the oblique line on the thyroid cartilage. When we will see the larynx, we see that on the thyroid cartilage, we have an oblique line from which different muscles arise. So this is arising from the oblique line on the lamina of the thyroid cartilage here. Okay. Now, then we have this muscle. Okay. This muscle, if you see, it goes and it is inserted in this fibrous, median fibrous raphe. Okay. Now, this muscle is the cricopharyngeus muscle. This arises from the cricoid cartilage here, the cricoid cartilage. It is also going and is inserted into the median fibrous raphe. Now, what is the difference? That the thyropharyngeus muscle, this one, even though both these muscles are a part of the inferior constrictor of pharynx, but the nerve supply of the thyropharyngeus and the function of thyropharyngeus is different from that of cricopharyngeus. Okay, this thyropharyngeus muscle here, it's supplied by the pharyngeal plexus and the external laryngeal nerve. Okay, the thyropharyngeus is supplied by the external laryngeal nerve. This muscle helps in deglutition in propulsion activity. ठीक है, ये नीचे की तरफ खाने को बेचता है. ठीक है, अब cricopharyngeus muscle जो है, that is supplied by the recurrent laryngeal nerve. ठीक, और इसका काम क्या होता है? That it acts as a sphincter. Is it clear? So I said that the inferior constrictor muscle has two parts. We have the thyropharyngeus and we have the cricopharyngeus. The thyropharyngeus is supplied by the external laryngeal nerve. It helps in deglutition and in the propulsion activity. नीचे की तरफ खाने को लेके जाता है. Cricopharyngeus muscle, on the other hand, is supplied by the recurrent laryngeal nerve, and it has a sphincter-like activity. Okay. Okay. Now, ये सब बोलने की importance क्या है? Now, normally, what will happen? Normal circumstances. Now, what should happen? When this muscle, that is the thyropharyngeus muscle, contracts, the cricopharyngeus muscle should relax, ताकि जो खाना है वो नीचे की तरफ आ जाए, right? क्योंकि वो sphincter की तरह act कर रहा है. Is it clear? So normally the inferior thyropharyngeus muscle contracts and the cricopharyngeus muscle relaxes. Okay? Now we have a condition that is known as the pharyngeal pouch or Zenker's diverticulum. Okay, Zenker's diverticulum. This is an important question. What do you mean by this? So, as you've seen here in this diagram, we see that there is a potential gap between the thyropharyngeus and the cricopharyngeus muscle. There is this potential gap. That is, normally ये gap वहाँ है, ठीक है? Now, अब क्या होता है? The mucosa and the submucosa of the pharynx may bulge through it. ठीक है? कभी-कभी the अंदर जो mucosa lining है, it may come up, ठीक है? And it forms a pouch or a diverticulum. अब ये डाइवर्टिकुलम नॉर्मल कंडीशंस में नहीं होता, क्योंकि नॉर्मल कंडीशंस में इसकी और इसकी स्ट्रेंथ ठीक है, ये कॉन्ट्रैक्ट करेगा, ये रिलैक्स करेगा, खाना नीचे आएगा. मगर अगर कोई भी कंडीशन ऐसा होगा वेयर देयर इज एन इनकोऑर्डिनेशन बिटवीन द थायरोफेरेंजियस एंड द क्रिकोफेरेंजियस, ठीक है, व्हिच विल हैपन इन अ न्यूरोमस्कुलर इनकोऑर्डिनेशन. ठीक है, क्यों? क्योंकि दोनों का नर्व सप्लाई इज डिफरेंट. ठीक है, सो व्हाट विल हैपन if the cricopharyngeus fails to relax when the thyropharyngeus is contracted? What will happen? The food bolus that was present in the pharynx will come out of this potential space. I'll repeat it again. So normally the thyropharyngeus and the cricopharyngeus, which are a part of the inferior constrictor muscles, but they are supplied by different nerves, right? And there is a potential space here between the two parts of these muscles. Okay? So normally, what happens when thyropharyngeus contracts, cricopharyngeus relaxes, food bolus moves down. Okay? Now, if there is any incoordination between the thyropharyngeus and the cricopharyngeus, because we have this potential space here that is known as the Killan's dehiscence. This space is known as the pharyngeal dimple or the Killan's dehiscence, which is normally present there. So what will happen if this muscle contracts and this fails to contract? So the food bolus will move out of this weak point and will produce a diverticulum, a pouch that is known as pharyngeal pouch or Zenker's diverticulum. So here you can see this was the Killan's dehiscence between the cricopharyngeus and the thyropharyngeus. अब क्या हो रहा है? Diverticulum निकल रहा है. This is a lateral view. You can see कि ये कॉन्ट्रैक्ट नहीं कर रहा, ये कॉन्ट्रैक्टेड है क्रिकोफेरेंजियस. यहाँ से इंफीरियर कंस्ट्रिक्टर का दूसरा पार्ट भी कॉन्ट्रैक्टेड है. तो व्हाट विल हैपन दैट जो फूड बोलस वाज प्रेजेंट, बिकॉज इट इज नॉट एबल टू मूव डाउन, इट विल प्रोड्यूस अ डाइवर्टिकुलम दैट विल कम आउट ऑफ दिस स्पेस. ठीक है, तो ये पूछा जाता है. ओके, so this is the Zenker's diverticulum. Then another important viva question is this, that is gaps in the pharyngeal wall. Okay, so when we look at the pharyngeal wall, the constrictor muscles जो है, there are 4 gaps that are present on either side of the pharyngeal wall, and these gaps are present in relation to the constrictor muscles. Okay, what are these gaps? So to start off, first we'll see that there is a gap between the base of the skull and the upper part of this muscle, that is the superior constrictor muscle here. This gap is known as the sinus of Morgagni. They ask you what are the different gaps and what are the structures that pass through this gap. This is an important viva question. ठीक है? So यहाँ से क्या क्या जाता है? We have this, that is the auditory tube. We have a muscle that is attached to the auditory tube, that is the levator palatine muscle. Then we have an important artery, that is the ascending palatine artery. And we have palatine branch of the ascending pharyngeal artery as well. So basically, we have four things that pass through this space. The first space that is between the base of the skull and the superior border of the superior constrictor muscle, pharyngeal tube, eustachian tube, liver villi palatine muscle, ascending palatine artery, and palatine branch of the ascending pharyngeal artery. Then we have another gap that is present between the superior constrictor and the middle constrictor. What passes through it? We have the stylopharyngeus muscle head, and we have a nerve here that supplies the stylopharyngeus muscle, that is the glossopharyngeal nerve. Then between the middle constrictor and the inferior constrictor, we have another gap. The gap gives passage to the internal laryngeal nerve and the superior laryngeal artery. Then between the lower border of the inferior constrictor muscle and the esophagus, we have a gap that is known as the tracheoesophageal groove. The structures that pass through the tracheoesophageal groove are the recurrent laryngeal nerve and the inferior laryngeal artery. So this is another diagram that's showing the same thing. There is a gap between the base of the skull and the upper border of the superior constrictor head, then between the superior constrictor and the middle constrictor, then between the middle constrictor and the inferior constrictor, and then we have a space that lies between the esophagus and the inferior constrictor muscle head. Below the inferior constrictor, we have a space that is present between the trachea and the esophagus that is known as the tracheoesophageal groove. Now, coming to the longitudinal muscles. So we have longitudinal muscles which are running downwards. When we look at these longitudinal muscles, what are these longitudinal muscles? These longitudinal muscles are this one, that is the palatopharyngeus. We have this one, that is the salpingopharyngeus, and we have this muscle that is known as the stylopharyngeus. Three muscles. Let's talk about the stylopharyngeus muscle first. When we look at the stylopharyngeus muscle, it is arising from the base of the styloid process. It is going and is inserting into the posterior border of the lamina of thyroid cartilage. These three muscles are inserted into the posterior border of the thyroid cartilage. ठीक है, तो इंसर्शन तीनों का एक ही जगह है थायराइड कार्टिलेज के पोस्टीरियर बॉर्डर पे, जो हमें यहाँ दिखता है. ओरिजिन डिफरेंट है, स्टाइलोफेरेंजियस है, तो ऑब्वियसली इट विल अराइज फ्रॉम द स्टाइलॉइड प्रोसेस. ठीक, देन वी हैव द palatopharyngeus. The palatopharyngeus will arise from the palate. So the palatopharyngeus arises by two fascicles from the palatine epineurossus, moves down, is inserted into the posterior border of the lamina of thyroid cartilage. Then we have this muscle that is the salpingopharyngeus that is arising from the lower border of the auditory tube, and it is inserting into the thyroid cartilage. These two muscles, that is the palatopharyngeus and the salpingopharyngeus, they are supplied by the cranial root of accessory nerve via the pharyngeal plexus. Okay. Whereas this muscle, that is the stylopharyngeus muscle. The stylopharyngeus muscle is muscle that was passing from where? It was passing from the gap between the superior and the middle constrictor. The stylopharyngeus muscle is the only muscle in the body that is supplied by the glossopharyngeal nerve. Another viva question. So the glossopharyngeal nerve supplies only one muscle in the body, that is the stylopharyngeus. ठीक है? So ये एक और viva question आपका आ सकता है. So अभी तक के लिए what we saw, viva questions के लिए you have important structures, that is Walde's ring for viva. You have an important thing that is the pharyngeal pouch, important for viva, and the gaps in the pharyngeal wall, that is important for viva. And another important question, that the muscle, only muscle in the body that is supplied by the glossopharyngeal nerve. Okay, so this is another cut section that is showing the different longitudinal as well as constrictor muscles. So here we can see this. This is a sagittal section, right? So here we see the pterygoid humulus. This was the superior constrictor muscle. Then we had the middle constrictor muscle, and then obviously lower down we have the inferior constrictor muscle, right? Yahan pe we see what? We have the longitudinal muscles. This was the palatopharyngeus here. This was the stylopharyngeus muscle here. And then we had one more muscle, that was the salpingopharyngeus muscle. यहाँ पे दिख रहा है. So this is salpingopharyngeus, palatopharyngeus, and obviously here we have the stylopharyngeus. Okay. Coming to the arterial supply of pharynx, when we look at the arterial supply of pharynx, we see that it is supplied mainly by the ascending pharyngeal artery, that is a branch of the external carotid artery. It is supplied by the ascending palatine artery, that is a branch of the facial artery. Then it is also supplied with the greater palatine artery and the pharyngeal artery and the lingual artery. So basically the lingual artery, the ascending pharyngeal artery, the ascending palatine artery, they supply the pharynx. Okay, यहाँ पे एक और important question is branches of the external carotid artery. You should remember all the 8 branches of the external carotid artery. The venous drainage, when we look at the venous drainage of the pharynx, we see that it is drained into the pharyngeal venous plexus. The pharyngeal venous plexus ultimately goes and drains into this pharyngeal plexus जो है, that is present on the pharynx, posterolateral aspect of the pharynx on the middle constrictor, and it ultimately goes and drains into this vein, that is the inferior jugular vein. Talking about the lymphatics of pharynx, so the lymphatics of pharynx drains into the upper and the lower deep cervical lymph nodes, and these go and drain into the retropharyngeal lymph nodes. Okay. After this, another important viva question, that is the nerve supply of pharynx. So obviously, when you talk about the nerve supply of any area, we should know the motor as well as the sensory nerve supply. So talking about the motor supply, all the pharyngeal muscles are supplied by the cranial root of accessory via the pharyngeal branch of vagus and the pharyngeal plexus, except the stylopharyngeus muscle, which is supplied by the glossopharyngeal nerve. As I've told you that glossopharyngeal nerve एक ही muscle को supply करती है body में, that is the stylopharyngeus. बाकी all the muscles of the pharynx are supplied by the cranial root of accessory via pharyngeal branch of vagus. This is another viva question. I told you in tongue as well that they ask you all the muscles of tongue are supplied by dash except dash, which is supplied by dash. Same way, all the muscles of pharynx is supplied by dash except dash, which is supplied by dash. So you have to fill in the blanks. Okay. Then the sensory supply. So when we look at the sensory supply of this area, the sensory supply of the nasopharynx here is by the pharyngeal branch of what? Of the pterygopalatine ganglion. As you know, the pterygopalatine ganglion carries fibers from the maxillary division of the trigeminal nerve. Then we have the oropharynx. The sensory supply to the oropharynx is via the glossopharyngeal nerve, whereas that to the laryngopharynx is by the internal laryngeal nerve. Then we have another thing that is known as the pharyngeal plexus of nerves. The pharyngeal plexus of nerve is formed by what? When we see here, this is the same thing that forms the pharyngeal plexus. The pharyngeal plexus is present on the posterolateral aspect of the pharynx, here over the middle constrictor, underneath the buccopharyngeal fascia के deep present होगा. This is formed by किन चीजों से बनता है? So this is formed by the pharyngeal branch of vagus that we're carrying the fibers of the cranial root of accessory. It is formed by the pharyngeal branch of the glossopharyngeal nerve, which is sensory, and it contains fibers from the pharyngeal branch of superior cervical sympathetic ganglion. Okay, and sometimes it also contains branch of the external laryngeal nerve. So this is your pharyngeal plexus. So this finishes your pharynx. We'll be dealing with the palatine tonsil and the palate in the next lecture. Thank you.